Selenium is an essential trace mineral, and it's involved in numerous reactions and incorporated into many functional molecules in the body. Seafood and Brazil nuts are among the richest sources of selenium, but many other plant and animal foods contribute to the selenium intake. The role of selenium in cancer became apparent when it was discovered that populations who are lacking this mineral in their diet, such as people living in geographical areas with low soil levels, had higher rates of certain cancers. Selenium compounds regulate the balance of pro-oxidant and antioxidant chemical reactions in the cells. Some selenium compounds promote cancer cell death. They regulate the immune and inflammatory pathways, and they prevent new blood vessel growth and tissue changes that can lead to cancer spread. Other selenium compounds protect the DNA from oxidative damage. The exact effect depends on the nature of the selenium compound and the dose. In the Nutritional Prevention of Cancer trial, participants with a history of basal or squamous cell carcinoma of the skin were given 200 micrograms of selenium per day as a selenium-enriched yeast for an average of 4.5 years. After a 6.4 year of follow-up, the occurrence of those two types of skin cancer did not change, but there were reductions in the new diagnoses of lung, prostate and colorectal cancer. A later analysis of the data found the benefit of selenium supplementation for lowering prostate cancer risk was limited to men who began the trial with lower circulating levels of selenium. A meta-analysis that included 12 studies, totaling more than 13,000 individuals, found, compared with men with blood selenium levels of about 60 nanograms per ml, the men with levels of 135 nanograms per ml had a 15 to 25% lower prostate cancer risk, and a 40 to 50% lower risk for advanced prostate cancer. A study that assessed selenium levels in patients with newly diagnosed laryngeal cancer found the patients with the levels higher than 70 nanograms per ml were more likely to survive for 5 years. People with higher selenium levels have also been found to have a lower risk of precancerous colon polyps and colorectal cancer. A number of studies have noted a correlation between a greater soy intake and a lower risk of certain cancers. Soybean constituents have demonstrated properties that might reduce cancer development and progression, such as inhibiting the cancer cell growth, proliferation and the metastases, suppressing new blood vessel formation and promoting cancer cell death. Soybeans, like all legumes, contain compounds classified broadly as phytoestrogens. Phytoestrogens are plant chemicals that are structurally similar to, but not identical to, human estrogens. There are 4 main categories of phytoestrogens: isoflavones, stilbenes, cumestins, and lignans. Soy is a major source of the isoflavone genistin and didesine, while all beans and lentils are rich in lignans. One mechanism by which the soy and its phytoestrogens can lower the risk of cancer development and recurrence is by inhibiting aromatase, the enzyme that stimulates the conversion of testosterone into estrogen. Aromatase inhibition is an important strategy in breast cancer treatment, especially in postmenopausal women, in whom aromatase activity is a major contributor to the estrogen pool. Phytoestrogens appear to have either estrogenic or anti-estrogenic effects, depending in part on the type of estrogen receptor present in a particular tissue. Soy isoflavones have been shown to be strong activators of a receptor type called estrogen receptor beta, and weak activators of another type called estrogen receptor alpha. Tissues such as the ovaries and the lungs typically have more estrogen receptor beta, while uterine and breast tissues have more estrogen receptor alpha, and bone has a similar amount of both. Emerging evidence suggests that estrogen receptor beta activation might suppress tumor development and growth. Because of the ability to stimulate different effects in different tissues and cells, phytoestrogens are sometimes described as a natural selective estrogen receptor modulator, or a phytoserm. Tamoxifen is a well-known drug SERM, and the soy isoflavone genistin is an example of a phytoestrogen. Despite theoretical concerns and some preclinical data suggesting soy intake might stimulate breast cancer cells, several reviews of evidence from human research have concluded soy consumption is safe and potentially beneficial in patients with breast cancer and for breast cancer survivors. Soy consumption has been linked with a decreased risk of recurrence and improved survival in women with a history of breast cancer. A study that included more than 6,200 women with breast cancer found 21% decreased risk of death among the women with the highest dietary intake of the isoflavones. The effect was strongest in women with a non-hormone sensitive and typically more aggressive form of breast cancer. Preclinical research suggests soy isoflavones might enhance the effectiveness of chemotherapy agents commonly used to treat breast cancer, such as doxorubicin. Clinical trials have shown that soy intake does not interfere with the effects of tamoxifen. Soy intake has also been correlated with reduced prostate cancer risk. In a randomized controlled trial, supplementation with isoflavones decreased inflammatory markers and improved markers of immune function in men with prostate cancer, effects that could improve their prognosis. Soy isoflavones might inhibit prostate cancer through several mechanisms, including modulating hormone signaling, inhibiting growth and metastases, and inducing cell death. In addition, soy isoflavones have been shown to induce epigenetic changes in prostate cancer cells that diminish their malignant activity in the lab. In a clinical trial that enrolled men with rising PSA levels after prostate cancer treatment, which is considered a sign of recurrence, drinking 8 ounces of soy milk 3 times a day for 12 months led to a slowing of the PSA level. A soy-based combination supplement was found in another randomized control trial to slow the rising PSA level in the men who'd been treated previously for prostate cancer. In a trial involving men with active prostate cancer, consuming tomato products providing at least 25 milligrams of lycopene daily, along with the soy food providing 40 grams of soy protein daily, led to a significant reduction in blood levels of the protein that stimulates the formation of the new blood vessels. Soy and its isoflavones have a potential role in preventing and improving the outcome in patients with a broad range of cancer, including bladder cancer, stomach cancer, colorectal cancer, and lung cancer. Although soy has known anti-thyroid effects, clinical trials in adults suggest the consumption of soy foods does not compromise the thyroid function in individuals with adequate iodine intake. Vitamin C is a water-soluble vitamin and is found in fruits and vegetables, and it acts as a cofactor for many enzymatic reactions in the body, helping to balance oxidation and reduction reactions. Vitamin C also plays essential roles in cellular energy production, protein assembly, and epigenetic regulation. Vitamin C might benefit patients with cancer by exerting direct toxic effects in cancer cells, enhancing the effect of chemotherapy and radiation, strengthening immune defenses, and reducing inflammation. Patients with cancer have been noted to have exceptionally low levels of vitamin C, which has been correlated with shorter survival. Intravenous administration of vitamin C can raise the levels higher than those achievable with oral doses. When high doses are administered intravenously, vitamin C has a pro-oxidant action, with more damaging effects on cancer cells than healthy cells. Evidence from cell culture studies suggests vitamin C does not reduce the effectiveness of chemotherapy and radiation, and furthermore, intravenous vitamin C can improve immune function and it may suppress new blood vessel growth. Lab research indicates certain fast-growing cancers may be particularly susceptible to the toxic effects of vitamin C. Although the ability of vitamin C to inhibit different cancer cells can vary, the anti-cancer properties of vitamin C has been noted specifically against melanoma cells and stomach, prostate, brain, lung, and pancreatic cancer cells. high-dose intravenous vitamin C was first reported to improve the long-term cancer survival back in the 70s. However, this benefit has not been noted with high-dose oral vitamin C. In a more recent clinical trial, 25 women with ovarian cancer received chemotherapy alone or combined with intravenous vitamin C, given during chemotherapy at increasing doses of up to 75 or 100 grams per infusion, depending on each of the participants' blood level. Women who received the vitamin C had less chemotherapy-related toxicity. A possible synergism between intravenous vitamin C and the platinum-based chemotherapies used in the trial was observed in an in vitro study using mice tumours as a model. Intravenous vitamin C therapy is safe in most people. However, such therapy is contraindicated in individuals with kidney disease, a rare genetic disease called glucose 6-phosphate dehydrogenase deficiency, and possibly an iron storage disease called hemochromatosis. While vitamin C remains a promising cancer adjuvant, its clinical application awaits further quality control trials of pharmacologically dosed vitamin C in specific types of cancer. A 2020 mouse study might offer a solution to improving the efficacy of vitamin C, combining it with a fasting mimicking diet. A fasting mimicking diet, one that's plant-based, calorie restricted, low sugar, low protein and high fat, was shown to increase the effectiveness of pharmacologically dosed vitamin C treatment in a mouse model of mutated colorectal cancer. While both the fasting and the vitamin C delayed the tumour progression when used alone, the combination was even more effective. Interestingly, the combination of the fasting diet or the high-dose vitamin C with the common chemotherapeutic drug oxaplantin were all equally effective. However, the combination of the fasting diet, vitamin C and oxaplantin was the most effective at delaying the tumour growth and improving the survival, indicating a potential synergism between traditional drugs and these non-toxic adjuvants. Vitamin D is a fat-soluble vitamin with two major forms: vitamin D2 ergocalciferol, which is obtained from a few plant sources like mushrooms, and it's more commonly found in supplements and fortified foods, and vitamin D3 cholecalciferol, which is generated in sun exposure, and it's obtained from food sources like egg yolks and oily fish. Vitamin D3 is also increasingly used in supplements. Both forms pass through the liver and the kidneys, where they're converted into 25-hydroxy vitamin D and 1,25-hydroxy vitamin D, respectively. The calcitrol binds to the vitamin D receptor on the cell surface, and this is responsible for functions such as the regulation of calcium metabolism. Vitamin D has many beneficial effects that can inhibit the onset and the progression of cancer. Among these are its ability to interfere with cancer cell signaling pathways, to stimulate cancer cell death, promote normal cell division and maturation, and inhibit new blood vessel growth. Low vitamin D levels have been associated with greater risk and higher mortality from some cancers, including skin, breast, prostate, colorectal, bladder, kidney, pancreatic, lung, and ovarian cancer. In a large meta-analysis of studies in women with breast cancer, increasing the vitamin D levels was strongly correlated with decreasing mortality rates. In a study published in the Journal of Clinical Oncology, vitamin D supplementation was shown to decrease cancer-related mortality. The meta-analysis of 10 randomized control trials included nearly 80,000 participants who were given vitamin D supplements for at least 3 years. Vitamin D did not affect the cancer incidence. However, those who took the vitamin D experienced a 13% reduction in cancer-related deaths compared with the placebo. A review of studies found strong evidence for a relationship between sun exposure and a lower risk of 15 types of cancer, and weaker evidence for 9 other types. In addition, people who were diagnosed with cancer in the summer or the fall, when vitamin D production is the highest, have been reported in some, but not all studies, to have a greater chance of a favourable outcome compared with individuals who are diagnosed in the winter or the spring. Although findings from clinical trials are limited, vitamin D supplementation appears to reduce the occurrence and the progression of some types of cancer. In conjunction with conventional treatments, vitamin D supplements have been shown in some studies to benefit individuals with breast, prostate and colorectal cancers, as well as melanoma. Supplement-induced improvements in cancer treatment outcomes are likely to be more pronounced in people with vitamin D insufficiency or deficiency. Vitamin D supplements can help patients receiving palliative care for incurable cancer by decreasing pain, preventing infection and improving the overall well-being. In patients with advanced incurable cancers and vitamin D insufficiency or deficiency, adding 4,000 international units per day of vitamin D reduced cancer-related pain and the use of opioid medications to control the pain, and it increased the quality of life after 1 month, as well as reduced infections and the use of antibiotics after 3 months. Vitamin D has been proposed to help to limit cancer treatment-induced bone loss in patients using hormone therapies to manage breast and prostate cancer. Chemotherapy itself appears to decrease the production of vitamin D in the body. In a study involving 77 women with locally advanced breast cancer, nearly 80% of the participants had a vitamin D insufficiency at the start of chemotherapy. After 7 cycles of chemotherapy, 97% of the women had a vitamin D insufficiency. In another study, 81% of the patients newly diagnosed with acute myeloid leukemia receiving chemotherapy had a vitamin D deficiency at the beginning of the treatment. After 28 days of treatment, the average vitamin D level had decreased below the pre-treatment average. Patients with a higher level of vitamin D responded better to the treatment. In patients with colorectal cancer, severe vitamin D deficiency was found in one study to be 3.7-fold more likely in patients who'd received chemotherapy than those who hadn't, leading the authors to conclude that patients with colorectal cancer, especially if they're receiving chemotherapy, should consider vitamin D supplementation. A secondary analysis of the VITAL randomized control trial was performed between November 2011 and December 2017 to assess the effects of daily supplementation with vitamin D3 at 2,000 international units on advanced or fatal cancer incidence. A total of 25,871 subjects with a mean age of 67 years participated in the intervention period, which occurred over a mean of 5.3 years. The results showed no significant difference for cancer occurrence between the groups. However, there was a significant 17% reduction in a composite of metastatic and fatal cancer incidence in the treatment group compared to the placebo. When stratified by body mass index in comparison with the placebo, there was a 38% reduction in metastatic and fatal cancer for those with normal BMI, but no statistically significant difference for those who were overweight or obese. These results may be explained in part by the disparate vitamin D storage patterns in the overweight and the lean individuals. Those with greater amounts of adipose tissue might require higher doses to achieve optimal serum 25-hydroxy vitamin D levels, because fat tissue serves as a reservoir for vitamin D. Monitoring vitamin D status with blood tests and adjusting the dose based on the results might be more effective means of achieving and maintaining adequate levels. Vitamin E is a fat-soluble vitamin, and it occurs in 8 different forms in nature. 4 tocopherols, alpha, beta, gamma and delta, and 4 tocotrienols, alpha, beta, gamma and delta. Nuts, seeds and plant oils are rich sources of vitamin E. The vitamin is best known for protecting fatty molecules and tissues from oxidative damage and for reducing inflammation. Although alpha tocopherol is the most studied form of vitamin E, other forms appear to have unique properties. in some cases superior to alpha tocopherol, relating to preventing and treating chronic disease. Both tocopherols and tocotrienols have been found to have anti-cancer effects. Although a number of studies have noted a relationship between low vitamin E intake or levels and an increased risk of various cancers, clinical trials with alpha tocopherol have yielded disappointing results. In one trial, the combination of 400 international units per day of alpha tocopherol plus 200 micrograms per day of selenium actually increased the risk of high-grade prostate cancer, but 50 international units per day of alpha tocopherol reduced both the risk of and the risk of death from prostate cancer in another trial. Emerging evidence suggests non-alpha tocopherols, particularly gamma tocopherol and delta tocopherol, may be more important and effective for preventing cancer progression. Gamma and delta tocopherol inhibit the activity of a major inflammatory enzyme known as COX-2, and it's more versatile as a free radical scavenger than alpha tocopherol. Gamma and delta tocopherol have been shown to interfere with hormone signaling, suppressing the growth and the proliferation, and promoting cell death in several cancer cell lines. In addition, gamma tocopherol and a tocopherol mixture emphasizing gamma tocopherol have demonstrated tumor inhibiting effects in animal models of prostate, breast, and colorectal cancer. The observed negative effects of a high-dose alpha tocopherol supplementation might be due in part to resulting depletion of gamma tocopherol from blood and tissues. Tocotrienols also appear to be a promising anti-cancer agent. Not only do the tocotrienols inhibit inflammatory enzymes like COX-2, lab experiments show they also suppress inflammatory signaling involving NF-kappa B, reduce cancer cell proliferation, stimulate cancer cell death, interfere with cancer cell metabolism, and inhibit invasion metastases and new blood vessel formation. In an early stage trial in patients with pancreatic cancer, 200 to 1,600 milligrams per day of delta tocotrienol taken for 2 weeks before pancreatic surgery led to increased tumor cell death in surgical tissue samples. Lab research further suggests that tocotrienols might sensitize the cancer cells to chemotherapy drugs. Findings from a prostate cancer cell study suggest gamma tocopherol might enhance the anti-cancer effects of delta tocotrienol, indicating that synergism between different vitamin E forms might be important for their anti-cancer effects. Vitamin K is a fat-soluble vitamin with a well-known role in blood clotting. The importance of vitamin K in other aspects of health, including bone, cardiovascular, joint, cognitive, and metabolic health, have more recently been recognized, and some of its functions are still being discovered. Vitamin K occurs in 2 main forms: vitamin K1, phytoquinone, which is found in green leafy vegetables and other plants, and vitamin K2, a family of molecules called menaquinones, the MK4 through to the MK13. These are made from vitamin K1 by bacteria, including some that reside in the intestines and in animals. Vitamin K2 is found in some fermented and cultured food, as well as animal products. In a study that followed more than 7,200 participants for 2.8 to 5.8 years, higher dietary vitamin K1 intake was associated with a lower risk of death due to cancer, as well as death from any cause. However, for prostate cancer specifically, vitamin K2 may be more effective at reducing the cancer development and the progression. Several clinical trials have examined the effects of vitamin K in patients with liver cancer. A review of 4 trials in patients with liver cancer reported that treatment with vitamin K1 led to a slowing of tumor growth and longer survival. All of these trials used the extraordinarily high dose of 40 milligrams per day. Nevertheless, no toxicity was reported. Case studies have reported beneficial effects from high doses of vitamin K2 of 45 to 90 milligrams per day in individuals with blood cell cancer. A synthetic vitamin K2 analogue has been investigated as a potential adjuvant therapy for liver cancer. In a meta-analysis of 6 randomized trials with a combined total of 930 participants, it was found to reduce the long-term recurrence rates and to improve survival rates in patients with liver cancer treated after surgery. In one randomized control trial, the use of 45 milligrams daily after a liver surgery led to fewer recurrence over 5 years of monitoring. Vitamin K has demonstrated anti-cancer activity against several cancer cell types in the lab, including lung, breast, pancreatic, and colon cancer cells. The anti-cancer effects of vitamin K are induced by increasing oxidative stress, inhibiting cell division and proliferation, promoting cell death, and modulating cellular signaling pathways in the cancer cells. Furthermore, vitamin K has been found to enhance the effectiveness of the chemotherapy agent sorafenib in liver cancer cells in the lab. For more information on herbs, supplements, and natural treatment plans, check out my website.